Children's Health has made an excellent commitment towards health equity as well as for screening for social determinants of health and resource allocation for those needs. So social determinants of health are the conditions in which we all live, learn, play that have an impact on our health. So those conditions are things like food access and quality of housing. In 2022, we started screening for social determinants of health, or SDOH, digitally. We see that in the first year alone, 1 in 2 families, or 52% of the families that we've screened, had at least one social need.
The main social determinants of health we screen for are the financial, psychosocial support, the housing, the transportation, and the health literacy. You can get access to any language at any time where you can go through the questions, and the interpreter will help you ask the family questions as well.
Once we admitted this patient from the ER, the nurse came in right away to complete the social determinants of health screening, and they've been sleeping in the car with 2 other siblings, and they've been scared. The nurse who had this patient reached out to the social worker for a consult. The social worker was able to provide them hotel accommodation, and they were able to sleep soundly. Knowing how we can provide those resources for them is very important. And how can we find out and how can we know that is through asking those SDOH screening questions.
When we get the screener, we will make the phone call. A lot of times it is a transitional conversation because sometimes it's hard for families to admit, like, yes, I need help with this. And so we'll match up what you answered. Is that still a need? I will make sure that the family is comfortable with what I'm gonna send. And so whenever the parents are healthy and in a good space, then we know that the kids are gonna be healthy and in a good space, and it's just getting them the tools that they need.
As chaplains, my role is to follow up with patients, to offer them spiritual, emotional support, and to make sure that we take care of patients as they flag for social determinants of health. I carry my modalities or tools that I use in my intervention, and we have 3 main modalities we use, which is godly play, holy listening stones, and poetic medicine. And it's through our intervention with parents that they come to a place of meaning, a place of hope, a place of courage, so that they can be fully present to be able to take care of their children.
It's a genuine want to be better every day for the families. And although it's children's health and it's tiny humans focus, the parents are right there just as important.
As our society and our metroplex continues to grow, we see that diversity increases as well as the needs of our families. And so in order for us to continue to provide high quality care, we have to meet our families where they are and address those needs just by recognizing them.
We are making follow-up visits. We are providing resources to families. We are making databases of resources and communities that we can connect patients to families. We're working in tandem with our FRCs, social work.
We want to ensure that we are helping families while they're here in our care as well as during their recovery process. One of the things that's great about us is that we really live our mission, which is to make life better for children, and that's all children, including those that are most vulnerable.